Good evening guys. Ang topic natin ngayon ay ang introduction about surgery. Veterinary surgery is a branch of medical science that practices on animals and treatment of injuries or disease by manual procedure or operation with hand. Branch of surgery: orthopedics, antiseptic, aseptic, conservative, radical, minor, major, emergency, elective, cosmetic, reconstructive, plastic, and exploratory, and clinical surgery. Orthopedic surgery concerned with the preservation and restoration of function of the skeletal system, its articulation and associated structures. Antiseptic surgery is conducted with the use of antiseptic agents to control bacteria contamination. Aseptic surgery is carried out practically free of bacterial contamination so that infection and suffocation are avoided. Conservative surgery, wherein every attempt is made to or restore a disabled part rather than remove. Example: correction and immobilization of a fracture in a limb rather than its amputation. A radical surgery is by which the root cause or source of the disease condition is rectified, is removed. Example: radical surgery for neoplasm, hernia. Minor surgery is relatively simple to perform, having no risk on the life of patient, and this requires the service of no assistant. Example: opening of a superficial abscess, wound dressing. Major surgery is relatively difficult to perform rather than minor surgery. Is time consuming, involve risk on the life of patient, and requires the help of an assistant. Example: cesarean section, thoracic surgery. Emergency surgery is performed urgently to avoid further complication of the disease process or to save life of the patient. And elective surgery. An elective surgery which can be postponed without endangering the life of patient. Cosmetic surgery is done either to improve the appearance of an animal or to satisfy the sentiments of the owner. Example are ear trimming, tail docking, and many more. Reconstructive surgery, done for the correction of deformities or malformations. Example: correction of cleft palate. Plastic surgery, performed for the repair of defects or for the correction of deformities, either by direct union of parts or by transfer of tissues from one part to another. Exploratory surgery is done to arrive at a diagnosis or for the confirmation of diagnosis. Clinical surgery is a surgery taught with the presence of patient so that the objective symptoms and the treatment given can be actually observed by the patient. So done with a branch of surgery. So let's proceed to what's the constitutes VET surgery within the definition proved by law. Ano ba ang kasali sa VET surgery provided by law? So let's proceed. Ang medicine versus surgery. Ang medicine denotes treatment of disease by the administration of drugs or other sedative substances. Surgery, science which treats mechanical or operative measure for healing disease, deformities, or injuries. So, therefore, it is impossible for one to be qualified to render either kind of treatment without being grounded in the other. So, hindi pwedeng surgery lang na walang medisina at hindi pwedeng medisina lang na walang surgery. They are bound. Is acupuncture a practice in surgery? According to the reference, it is yes. The court says that if the skin is punctured or a bodily tissue is disrupted in some way, this amounts to surgery. Exceptions of Veterinary Practice Acts. So, may batas dun para accepted sa mga duty ng vet. So, what is it? Individuals who treat their own animals, and it is qualified that this right by saying such treatment must be in humane manner. Second, Practice Act says that medical doctors and dentists do not have the right to treat animals. Similarly, vets do not have the right to treat human patients. Goals or reason for surgery. What are the goals or reasons for surgery? Bakit nga ba? To save the life of an animal. Example, surgery in case of acute intestinal obstruction. To prolong the life of animal. Example, removal of malignant tumor. To hasten recovery for injury. Example, splitting fractures, suturing of wounds. Fourth, for elimination of disease process. Example, extraction of a diseased tooth. Removal of a benign tumor. Fifth, for cosmetic reasons. Example, ear trimming, tail ducking, trimming of ears, tail ducking. 6. For correcting deformities or malformations. Example, correction of congeniality deformity like cleft palate or cryptorchidism. 7. For the replacement of parts by an artificial one. Example, artificial eye, artificial limb, prosthetic hip. 8. On economical reasons to make an animal socially acceptable. Example, spaying, castration, dehorning, deblating of sheep, the barking of dogs. Number 9, to aid and diagnosis of suspected pathological process. Example, exploratory laparotomy. Number 10, for investigation and research work. Example, experimental surgery sa salivary fistula. So, informed consent. So, kung nag-practice kayo ng surgery, kailangan nyo i-inform yung patient with or sa owner consent na kung mag-proceed sa surgery or other way kung unsa gamiton tambal ibigay anong mangyari kung ibigay yung medicine na yon sa hayop. So the informed consent holds that if the surgery is performed or substantial change in treatment is made without adequate information the client of the risk and the cost involved without procuring the client's consent, such surgery or treatment is unauthorized ang law. And the veterinarian can be held liable in a malpractice action. So, it is law. The court have said that the consent must be informed. Consent ba yun? Consent must be informed. If a veterinarian makes a hasty explanation to the client and the change in treatment does not achieve a good result, the client may say, yes, I agreed to have you go ahead, but I don't understand what might happen. So, uninformed. Kasi hindi niya alam kung ano mangyari. So, dapat i-inform siya. Minsan talaga, di yan siya may iwasan kasi minsan may emergency, pero hindi naman lahat ng ginagawa is emergency. So, kailangan naintindihan ng client kung anong gagawin. There are instances in which it is impossible to communicate with the client or get consent without the treatment that a veterinarian regards as an essential. Kagaya ng yung maid lang yung nagdala ng hayop, mayaman yung may-ari. So, hindi niya alam kung anong mangyari sa hayop niya. So, mahirap yun. In that case, the veterinarian must use his own judgment about what to do and hoping that the client agree. Otherwise, take the risk. So, yun yung mahirap. It is apparent that the failure to establish good communication with the clients and especially to get an informed consent, if not the following are among the possibilities. So, ano mangyari? So, yun. The client may institute an malpractice action claiming that he was not informed properly. The client may refuse to pay the veterinarian's fee. If so, for the fee, the clients may defend, claiming that there was a lack of informed consent. So, yun yung importante. Hindi ka bayaran kasi hindi siya na-inform na may bayaran pala. So, yun. Number 4, if the patient can show, if the client can show that the veterinarian is of uncommunicative nature and that other clients have suffered as he claims he did. Yun. A request that a veterinarian's license be rebuked or suspended might be filed with the state licensing agency or PRC. Some causes of malpractice actions. Anong mga causes? So, tingnan natin. Informative values that reach the court. So, ano yung mga cases na importante na talagang mabigyan ng malpractice action yung isang veterinarian. So, ano yun? Veterinarian's method of handling a valuable thoroughbreed resulting in an undesirable temperament. Second, when a drug was given in a horse through IM injection, in the wrong place, resulting in abscess and loss of horse. Claim of negligence in examining the uterus of mare. Negligence, ibig sabihin, neglecting. So, hindi niya gina-examine yung uterus ng mares. Mahirap yun. Negligent vaccination of pregnant gilt. So, meron pala doon. Kung hindi mo binakunahan yung gilt, tapos ikaw yung veterinarian doon, so pwede kang ma-filean na malpractice. Informal treatment, improper treatment of a dog that has been bitten by rabid dog. So, improper treatment can be made a malpractice, no? Negligence in the storage and use of hog cholera vaccine and virus. So, negligence, maling pag-store ng mga vaccine, no? Mga live vaccine na kayang mag-cause ng outbreak. So, yun. Number 7, negligence in handling cattle during vaccination. So, kung mali yung pag-handling mo ng cattle sa vaccination, so, pwede ka masabihan na malpractice, no? Dapat, yung naka-plano. Tapos naka-equipment, tapos naka-restrain. Hindi naman pwede turok mo yan, nagatakbo yung kalabaw kundi yung baka, no, di ba? Kailangan nakakuan yan. Napaloob sa isang ano yan? Yung anong tawag doon? Yung square na kuan, pinapasok mo ng baka, tapos ginaharang sa likod at sa harap para hindi mag-move. Tapos may nakalagay sa taas para hindi tumalon. Improper treatment, number 8. Improper treatment of a dog. So, improper treatment kung yung veterinarian mo pataka lang hatag og kuan mga medicine sa dog. Bisan hindi naman kailangan o ibig sabihin na yung namatay yung dog kasi nag-inject siya ng something na hindi niya alam, di ba? Improper malpractice yun. Magiging kuan yun. Tawag dun, pwedeng tanggalan ng lisensya. Number 9. Failure to properly diagnose and treat hogs for cholera. So, kung nandun ka sa pig industry or anong tawag doon? Pig industry? Swine industry. Tapos, failure, properly diagnosed, no? And treatment of hog cholera. So, outbreak yun. So, kung mali yung pag-diagnose mo as veterinarian, pwede kang tanggalan ng lisensya. As long as merong magpapatunay na ikaw yung nagawa nun. Na sinabi mo talaga. So, number 10, death of sheep used by improper administration of remedy for intestinal worm. So, anong example nun? Kunyari, ang veterinarian nag-inject siya for deworming. So, tapos, yung dose pala na binigay niya, so, malaki kaysa sa intended na kuan kasi gusto niya for one time na. Isang administration lang para matapos ng kuan yung tanggal talaga yung worm. So, mali yung dose niya tapos namatay yung sheep. So, talagang malpractice yun. Kasi may nakalagay man na dose na exact kung anong old yung sheep o anong old yung goat. Goat kadalasan kasi dito, ano. So, number 11, negligence in confining the mule prior to an operation resulting in paralysis and necessity to destroy. So, wala man masyadong mule, no? erroneous diagnosis and vaccination of hogs for hog cholera. So, nag-diagnose siya ng hog cholera, tapos hindi pala yun hog cholera, no? Mali yun. Pwede kang tanggalan ng lisensya pag veterinarian ka na. So, mahirap din. Kasi baka katulad yung tulad yung mga signs, tapos yung mga mga result, tapos mali pala yun. Number 13, negligent treatment by veterinarian resulting the death of hog. So, pwede kang tanggalan as veterinarian kung mga treatment mo nag-cause ng kamatayan ng isang baboy. Pwede ba yun? Siguro kung marami talaga. Kung maraming baboy. Yung kung isa lang man, kung medyo talagang mahina na yung baboy, so gitreat mo, hindi na talaga yun makuan. Kasi minsan sabihin ng veterinarian na useless na. O i-treat pa to, tapos malala na, di ba? Pwede na kuan na, for me, kuan na lang, ihawin, no? Kung hindi man lang buntis o kung wala man lang contagious disease na mapasa sa tao, no? Pwede. Huwag na lang i-treat. Number 14, death of dogs aligned to be used by properly prepared mince dip. So, kung mag-perform kayo ng mince dip tapos namatay yung dog, bakit kaya? So, baka na-infect, baka may bacteria, something. No? So, yan lang po. Questions? Walang question. Yung matalino may question, marami. So, thank you very much. God bless.